Hi, welcome to the Fireside Clinic. I'm Lori. I'll be examining you today. Can I get your name and your date of birth?
Yes. Alicia Winchester and May 11th.
Okay, how old are you, Alicia?
23.
And what brings you here today?
I have chest pains a little bit.
Okay, when did that start?
Like 2 days ago.
All right. Were you doing anything when it started?
No.
Just sitting in a chair?
Yeah.
Okay, had you been doing anything?
I'd been like exercising an hour before.
All right. Have you ever had that happen before?
No.
Okay. So can you tell me where exactly the location is?
Like right here.
So it's a sternal area.
Mhm.
Okay. How long does it last when you have it, or is it constant?
It lasts like 15 minutes.
Okay. How many episodes have you had of that in the last 2 days?
6.
6 times it's happened and it's lasted 15, 20 minutes.
Yeah.
Okay. And can you describe the pain?
Dull.
Dull pain.
Yeah.
Okay. Does it radiate anywhere? To your arms, to your neck, jaw, anywhere?
To my shoulders a little bit.
Both shoulders?
Yeah.
Okay. Just laterally.
Mm-hmm.
Okay. Have you taken anything to help relieve the pain?
Tylenol.
Tylenol.
Yeah.
Over the counter. And how many times have you had to take that?
Once.
Okay. So when you have it, how bad is the pain on a scale of 1 to 10, with 10 being the worst?
5.
Okay. And you take the Tylenol and it brings the pain level down to 0?
2.
2?
Yeah.
Okay. Have you used anything else to help relieve the pain?
No.
Does it wake you up at night?
No.
Okay. Does anything make the pain worse? Or
No.
bring the pain on that you notice?
No.
Okay. That's interesting. And you have no history of any kind of cardiac issues. Did you ever have rheumatic fever as a child?
No.
Have you ever had Lyme disease?
No.
Do you have any siblings with cardiac issues?
No.
Are your parents alive?
Mm-hmm.
Do they have any cardiac problems?
No.
Are your grandparents?
Mm-hmm.
They're alive?
Mm-hmm.
All 4 of them?
Mm-hmm.
Okay. Do they have any heart problems?
Not that I know of.
Right, well, that's interesting. Okay, I don't see no blueness in your lips, in your chest. Doesn't look any different. Do you take any medication on a regular basis?
No.
Do you take vitamins and
I take vitamins.
supplements?
Yeah. Not supplements, vitamins.
Just vitamins.
Yeah.
Do you use tobacco?
No.
Do you drink alcohol?
No.
Do you use recreational drugs?
No.
Okay, do you drink caffeine?
Yeah.
Do you drink coffee?
Yeah.
Do you drink energy drinks?
No.
No energy drinks?
No.
Okay. What about soda? A lot of soda.
Yeah, I drink soda sometimes.
Okay, how many times a week?
3, 4.
Okay. All right. Well, we'll examine you and see what we find out today, okay?
Mm-hmm.
We're also going to do an EKG, just
Mm-hmm.
because you came in with chest pain. And it's just electrodes we put on you, and it's a real quick test.
Okay.
Okay, and I'll show us your sinus rhythm.
Mm-hmm.
Okay. Let's start out by looking at listening to your heart. I want to look at your capillary refill is good. It's under 3 seconds. Can I look at your feet too? Okay, and your other one? Okay, and as long as I'm here, I'm going to check your dorsalis pedis pulse, which is good, 2+. And your posterior tibial pulse, also 2 plus. Let's check the other one too. 2 plus. 2 plus. Good pulses. I also want to check your radial, your brachial. You're good. Carotid. And 2 plus. Your hands are really red.
Yeah.
And cold. Your capillary refill seems good, but they are very red. They get like that when it's cold?
Yeah, I guess.
Okay. I want to check check your femoral pulse when I check your abdomen. I want to check your carotid for bruits with the bell. I don't hear anything. No bruits. All right, and I can't see your PMI, point of maximum intensity, but I can feel it. That's where your mitral valve is. All right, I'll listen with the bell first, since I've got it on the bell, and then I'll listen with the diaphragm. So we're going to start at your second intercostal space on the right sternal border, and that's the aortic valve. And we'll go across the other side of your sternal border, the second intercostal space, that's your pulmonic, very loud. Drop down to the third intercostal space, also left sternal border. That's Erb's point. Go down one more. And I hear the tricuspid on the fourth intercostal. And if you can lift your shirt up. We're going to go to the fifth intercostal, the midclavicular line. And there's your mitral. Okay, I'm going to turn this and we're going to listen again. Okay, and we'll go back and start up here. Good heart sounds. I'm just hearing S1 and S2. That's the lub-dub. Nothing unusual. No murmurs, no gallops, no rubs. Everything sounds good.
Okay. Good.
Yeah, and I don't see any cyanosis, so you do have some red hands. Look at a little bit of Raynaud's. Has anyone ever mentioned that?
Yeah, a little bit before. They don't feel cold.
They don't, but they feel
Just to the
cold
touch. Yeah.
All right.
It's interesting.
Let me have you lie down, and we'll check your abdomen.
Okay.
I'll oscillate that first. After I look at it, I don't see anything unusual, no masses, no bulging anywhere, no tattoos, no piercings. Okay, let's listen. We'll start at your right lower quadrant. There's the bell sounds. Okay. I'm hearing vowel sounds. They're normoactive. They're not hyper or hypo. Just normal. I want to listen to your aorta here with the bell. No bruits. And your renal artery. Another renal. Your iliac. feel your pulse too here. Two plus pulse is good, and I don't hear any bruise. I'm going to palpate. I hear resonance. Exactly what I should hear. Let me know if anything's tender. I don't hear any dullness at all. I'm going to lightly palpate. About 1 centimeter. Okay, very lightly. Let me know if anything's tender. Good. I'm going to go a little deeper now. No tenderness.
No.
And I don't feel any masses. All right?
Okay.
Let me try a test for your appendix. It's called McBurney's point. And I'm going to press down gently and then pull it real quick, okay? And let me know if it's tender.
No.
Okay, I'm going to try another one, Murphy sign. I want you to exhale. Exhale. Now inhale. No tenderness.
No.
Okay. Murphy sign is to check for your gallbladder. All right, if you go uncross your feet, we're going to do the iliopsis test. The iliopsis muscle lies over your appendix, and when it moves, it will put pressure on your appendix, and it would hurt if the appendix was inflamed. So I want you to lift your leg, and I'm going to press against it. Any pain in your right middle quadrant?
No.
Okay, we're going to try one more. Check the obturator. That's also a muscle that's over your appendix. And if your appendix is inflamed, you will feel pain. Any pain?
No.
Good. Right, so you can sit back up. I'm going to look at your lungs now. Your chest looks symmetric. I don't see labored breathing. It's a normal, unlabored respirations. I don't see any masses, no deformities. You're not barrel chested. I'm going to check for chest expansion back here. Just breathe in, breathe out. There we go. Normal, symmetric chest expansion. While I'm back here, I'm going to try the tactile firmitas. Every time I put my hands on you, you say 99, okay?
99. 99. 99. 99.
Okay, lift up your arms.
99. 99. 99. 99. 99. 99.
Okay. I didn't feel that vibration. Don't feel any consolidation. And to listen. Just breathe normally. Okay, you want to lift up your arms. Okay, and the right Z pattern.
It's left. It's my left.
Oh, I'm sorry. So that's C. It's my right.
Okay.
And then we'll do the Z pattern on this side. All right, now listen in the back. Okay, I don't hear any adventitious breath sounds. Everything sounds clear. We'll check for consolidation. I'll do 3 tests. They're called bronchophony. You'll say 99 again. Then we'll do egophony. We'll just say the letter E. And then we'll do whisper patriloquy. You'll say happy birthday.
Okay.
I'll do the front first, and then we'll go to the back.
Okay.
99.
99. 99. 99. 99.
And lift up your arms.
99. 99. 99. 99.
All right, and let's say E.
E. E. E. E. E. E. E. E.
And then happy birthday.
Happy birthday. Happy birthday. Happy birthday. Happy birthday. Happy birthday. Happy birthday. Happy birthday. Happy birthday.
All right, and let's try the back. If you want to cross your arms, I'm going to back up a little bit more. All right, let's start with 99.
99.
Say it low.
99. 99. 99.
Okay, now E.
E. E. E. E.
E is very clear. Okay, happy birthday.
Happy birthday. Happy birthday. Happy birthday. Happy birthday.
All right, no consolidation. I didn't hear 99 or happy birthday. I couldn't make that out. I could make out the E clearly. So your abdomen's good, your heart's good, your lungs are good. Okay, let's go to your head. Looking upon inspection, I don't see any infestation. You have a normocephalic, atraumatic head. Hair is soft and supple. I don't feel any lesions, masses, anything like that. Okay. Your nose is lined up nicely. Your maxillary sinuses don't feel inflamed. Your frontal sinuses don't feel inflamed. Your pinna lines up with the inner campus of your eye. Your lobes and your tragus will be nicely done. Your trachea appears to be midline. I'm going to check from behind. Maybe swallow. Okay, I'm going to move this side to side. I don't feel any nodes or nodules in your thyroid. No thyroid enlargement. All right, okay, let's look at your eyes first. Your sclera looks white. Your conjunctiva is pink. It looks good. Let's check your pupils are equal, round, reactive to light. And I want you to look at my finger. I look into the room. I look at my finger. Good, to light and accommodation. All right, that's optic nerve 2. And let's check for your red light reflex. That's also 2. And I do see a red light. I do not see the optic disc though. It's just too bright. Sorry. There we go. Red light. Did I blind you?
Okay, I'm good.
Okay, that's also cranial nerve 2, the optic nerve. Now we're going to look at the oculomotor nerve.
Okay.
That would be the peripheral.
Yeah.
Tell me when you see my fingers and how many fingers I have.
1.
Okay.
2. 1.
Good.
Okay.
Oculomotor cranial nerve 3 is intact. Now let's check your cardinal signs, and that checks your cranial nerve 3, 4, and 6. 3 is the oculomotor, 4 is the trochlear, and 6 is the abducens. So we're going to follow my finger. Don't move your head, just your eyes. Great. Cranial nerves 3, 4, and 6 are intact. Okay. I'm going to check your nose. We don't have a smell test here. I don't have any essential oils, so we won't check that cranial nerve. But I will check. We've inspected it. I don't see any crookedness or septum deviation. And I'm looking inside. I don't see a septal deviation. Your turbinates are pink. There's no drainage. Everything looks very clear. Okay? Can I get you to open your mouth? Open wide. Stick out your tongue. Say ah.
Ah.
Ah. Your uvula, it goes up. It's midline. Your tongue is midline. Can you move your tongue left and right and then up and down? Good. Any problem with that? Oral mucosa looks good. I don't see any lesions. Don't see any broken teeth. Don't notice any obvious cavities. Can you say light, tight, and dynamite?
Light, tight, dynamite.
Great. That takes care of cranial nerves 9, 10, and 12. 9 being the glossopharyngeal, 10 is the vagus, 12 is the hypoglossal. All right. As long as we're doing the cranial nerves, let's do 11. I'm going to push down and you push up, like just shrug. Good. That's your accessory nerve, 11. So all of your cranial nerves are intact so far. Let's check your cranial nerve 8. That's vestibular cochlear. With your ears, we already inspected the outside. Let's look at the inside.
Did I hear game the word?
No. Okay,
Okay.
I do see some wax buildup. So it's a little difficult to see your tympanic membrane. I do see a bit of it, but I don't see the cone of light. It is pearly gray, what I do see. Let's check this one. Okay, this one also has some buildup, a little bit of waxy buildup, but I can see the tympanic membrane, and it is pearly gray, and I see a cone of light at 7. Well, that's good. I want to do a couple tests. going to be the Weber, a lay, and a whisper test. We'll start off with the whisper.
Mm-hmm.
I'm going to stand behind you, cover one ear, and I'm going to say 3 words and repeat them back.
Mm-hmm. Cat, pat, rat.
Okay, cover the other.
8, 10, 12.
Great. Now we're going to check for lateralization with the Weber test. I'm going to bang this and put it on top of your head. Tell me if you hear it on both sides.
Mm-hmm. Mm-hmm.
Great. Now with the next one, we're going to do Renee test for bone and air conduction. I'm going to hit it again. I'm going to put it back here. Once you don't hear it anymore there, I'll move it to here. And tell me you don't hear it here. Okay?
Okay.
I'll stand behind you. And I'm going to time it. Okay, you ready?
Mm-hmm. There. There.
Okay, great. Your air conduction is longer than your bone conduction. We're going to try to get on this side.
There. And barely hear it.
Can you hear it?
Okay. Yeah.
Let's do that one again, okay? I want to make sure we're doing it right.
Okay. And still barely hear it. It's really soft. Okay. It's gone.
Okay,
Fade it out.
we need to check that ear out because your bone conduction, your air conduction are about the same.
Okay.
So we're going to look into that a little bit more to investigate. Okay, so we've done your eyes, your ears, your nose, your mouth. I didn't do your lymph nodes. I did check your trachea, but I didn't do any of your lymph nodes. So let's try those. Here, these are your occipital. I don't feel anything. Your post-auricular, pre-auricular, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and your supraclavicular. I don't feel any enlarged lymph nodes at all. Nothing out of the ordinary, which is good. That's a good sign. Okay.
Mm-hmm.
I think we've covered everything. I do want to do an EKG, and I want to give you some D-Brox drops for your ear, get some of that earwax out.
Mm-hmm.
Okay.
Okay.
Do you have any questions for me?
I don't think so.
Is there anything you need to tell me that you forgot?
No.
Okay. Sit tight, and I'll be back in just a few minutes.
Okay.
EKG machine. Okay.
Mm-hmm. Thank you.
Mm-hmm.